Welcome everybody to this week's Health Blab. My name is Mike Warren. I'm with Alternative Health Concepts, and we've got an exciting program for you today. Really cool doctor with us that I know you guys are going to learn a lot, and I'm really excited to speak with her and to hear what she has to say. Also like to introduce my partner, Dr. Wayne Dorban. Right now, he's right underneath me. I know on the replay he'll be somewhere else on this screen. Excited to have you, Wayne. Thanks for being here.
Great to be here, Mike.
Just so you guys know, please go to our website if you haven't already. It's right under my name here. Sign up for our free ebook that you can get, all about building your immune system and how it can help you. Also, check out our products. We're the manufacturer of BioPro Plus and BioEqualizer now for horses. It's a bioidentical protein that helps your immune system. It's a thymic protein that is bioidentical to the proteins that your body produces now. If you're over the age of 40, you don't produce many of these proteins anymore. And we have this supplement that is actually amazing with people with all different chronic diseases, help rebuild their immune system and help their body heal themselves. So with that said, we'll get out of the commercial part and get over to our guest today, Dr. Eli Camp, naturopathic doctor. I got corrected last week. I was always saying naturopath, and she corrected me and said the proper pronunciation is naturopath. Is that correct?
It is.
Okay, great. Let me introduce you just real quick, and then I'm going to kind of turn it over to you, Dr. Camp. I was really excited. We've interviewed several naturopathic doctors here, and they all have a little bit of a different specialty. And with what I'm learning and going through with my wife and personally, this is an area that she specializes in called homeopathy, and I don't know that much about it. So I'm really excited today because I get to learn about that. And that's one thing I just really love about Blab and this format is I get to learn along with you that are watching this either live or on the replay, which you can also see all of our replays on our website. So Dr. Camp, welcome all the way from Oklahoma. We'll get into a little more of what she does, but I want you to introduce yourself to our audience and tell them what you do, and more importantly, you've got a great story on how you got here and why you chose this type of medicine to go into. So with that said, I turn it over to you.
Well, thank you, and thanks for having me. I spent some time looking at some of your previous blabs, and I see a lot of my colleagues there and some great topics. So I think you're doing a great job, Mike.
Thank you.
And you can call me Eli. It's fine. I'm pretty informal.
Great.
So how did I get here? Well, I'll tell you, there's so many different paths, I think, and many decisions I made in my life, but some of the biggest influencing factors that brought me to naturopathic medicine is one, my father's side of the family is Cherokee, and whether they realize it or not, interwoven through everything that side of the family talked about, exposed me to as a child and a teenager and a young adult, was about how the earth has what we need to be well. So that could be seen in the gardening my grandmother did, in the interest the family had in just being well, living well. And so I think I was influenced to understand what health could be, rather than how to simply fight disease in the world of medicine, that it was so much more about taking something to get rid of a symptom. And then my dad was in the military, and so I spent a lot of my very formative years in Europe, where they have a very integrated sort of idea of what medicine is. And that is, if you're not eating well, living well, sleeping well in a good community, in a clean environment, well, duh, that's a no-brainer, right? You're going to, in some way, set the stage for illness. And so when you go in and work with the majority of the doctors that it was exposed to in Europe, they asked questions like that. Well, what are you eating? And, what are you drinking? And what are you doing? And, you're frowning, you're unhappy. You can't be healthy if you're unhappy. And so, when I finally, I was in sales, marketing, corporate, making corporate people rich. I sold sunglasses. And it was
Nice.
it was a lot of fun, jeans and flip-flops and t-shirt kind of job. But I, late 20s, early 30s went through, I think, what a lot of people go through when they're not doing something that helps them reach their higher purpose. And I don't want to use the term existential crisis, but it really was. What am I doing with my life? I'm making these people rich, and I'm having fun at my job. But I don't think it's what you do. I think it's what you leave behind. Right. And there's a guy, Jim Cochran, he was one of the first organic strawberry farmers out in California, and Swanton Strawberry Farm. And he said that it's not what you do, it's what you leave behind. And so I decided, well, I'm going to go to school and be a doctor. And in that journey, right, of becoming a doctor, I very quickly realized that I didn't want to suppress symptoms. I wanted to help create health and wellness.
Awesome.
And in that journey, I found homeopathy.
Okay. And so a couple things I want people to know, because you are unique in the naturopathic realm, if you will, from what I've talked to and the different doctors that I've spoken with, is that you have 3 practices, one in Florida, one in Oklahoma where you live, and one in New Hampshire. I'm assuming you must have had some kind of roots in those 3 different areas.
I did.
Somehow you pick those anyway, so that they're beneficial to you and to your patients. But one of the other things that you do is you have people coming from all over the world to work with you and to have you help them heal themselves.
Mm-hmm.
And you have a great couple of websites, by the way.
Thank you.
An eCamp ND website, and then your Medicine Talk, which I really found interesting and fascinating. Some great articles. And so tell us a little bit about those 2 things before we really get into the meat of what I want to get into, and that's homeopathy.
Okay, so the first thing is my practices. That's the first thing?
Yeah.
Okay, so
Yes.
it's a very practical explanation. I came out of medical school, and some of my colleagues and I went to New Hampshire to open a practice. And we went there because one of the people in our group had very strong roots there, and she didn't want to go anywhere else. So we ended up in New Hampshire because that's where she wanted to be, which was home.
Okay.
Well, the day that the firemen were driving around after, 2.5 years there, saying, shovel your roofs tonight, my husband came in the front door and said, that's it. Anywhere we have to live where I have to shovel my roof is not where I want to be. And so I was like, okay, we moved around a lot anyway, because he was in the military too. And so we ended up coming to Oklahoma, where my father's side of the family is from.
Okay.
He, however,
hence the Cherokee and
yes,
that part of your,
Oklahoma.
yeah, okay.
Now, he couldn't get transferred here. He worked for the, Department of Homeland Security at that point. He couldn't get transferred from Boston to Oklahoma, and we were apart a year. And so I wasn't going back to the Northeast. And so we picked Florida because one of my best friends of 25 years lived outside of Tampa. And I said, well, heck, why not? And so he got a transfer pretty easily. And so we were in Florida for about 4 years. Now, here's why we're back in Oklahoma and I'm not in Florida. Is Florida doesn't have a law that licenses naturopathic doctors to practice medicine. In fact, it's a felony for naturopathic doctors in Florida. They're very behind the times. And so after 4 years, even though, it was great, I loved it. I didn't want to always be looking over my shoulder because someone thought that I was, doing bad things. So I came back here, and more power to all the brave NDs in Florida, holding the flame there. Hopefully they'll get licensed one day. So in the course of all of that, I had patients come to me who lived overseas, but they, for one reason or another, came to America on business, and they looked me up as a homeopath. Really, the homeopathy has been my window into working with people around the world. And they were here temporarily in America. I saw them. They went home. So people in Australia, France, Spain, Germany, England, for the most part, went home, told their friends about me, or their friends said, "What are you doing? Like, you look better. Your symptoms are gone. Whatever you're doing is working." And they would refer their friends, family, colleagues to me. And what I established pretty early on was a rule where either they have to come see me or they have to bring me over to wherever they are to see them for the first visit. And then I like to see them every year, but I'm also a realist, and sometimes money doesn't allow people to travel, internationally every year. So that's that for the practices. And it's concierge. I don't know if our viewers know what a concierge practice is.
No, explain that, because it's new to me, and I think it's a great option in many cases.
So it is not exactly like what they mean for concierge in mainstream medicine. In naturopathic medicine, a concierge practice is more like you are engaging for a year at a time with your naturopathic doctor to have them be accessible to you whenever you need them. And you usually pay a yearly fee, and then they can call me, text me. I meet my patients at the grocery store. I'll meet them at the furniture store to pick out non-toxic furniture. Of course, we deal with health and wellness, but after a couple of years, most of my patients are well, and I'm not getting them out of being sick anymore. And so I serve a different function for a lot of those patients. I help keep them well, or we deal with acute colds, flus. I cut my finger, I have headaches all of a sudden, things like that.
Sure. So talk just real quickly before we get into the homeopathy part. And I know you're a huge proponent of naturopathic medicine, and you go around and you speak, and you speak at colleges, you speak all over I don't know if it's all over the world, but for sure in the United States about it. And what do you say to those people that are new to it, like I was? I grew up, my father was a veterinarian, but very much trained in the allopathic ways. And when I grew up, chiropractors weren't real doctors,
right?
Let alone naturopaths. So talk to us a little bit about the science behind it, and a little bit about the results and the scientific proof, I guess, that a lot of people look to in the allopathic medical world for why they take these drugs or whatever. Obviously, there's got to be research in your line of work that why homeopathy works. So talk a little bit about that.
Okay, well, let me start at the beginning, and I'll make a Reader's Digest sort of explanation here. First, I'm going to say, what is naturopathic medicine? Naturopathic medicine is run by three very simple premises. One, you give the body what it needs. Two, you remove whatever may be poisoning the body. And three, you stimulate the vital force or the innate healing ability of the body. That is naturopathic medicine in a nutshell. Now, you have to then ask the question, how do you do that? What tools are in your tool bag, right? In our tool bag are botanical or herbal medicine, homeopathy, physical medicine, nutraceuticals, right? So supplements and things like that, mind, body, energy, basic lifestyle. I really hope I haven't forgotten anything. So we have and pharmacy. We have all of these tools in our tool bag that we can use to abide by the three basic tenets of naturopathic medicine. There is a lot of research, and just a little bit. So if you look at the world of dietetics or registered dietitians, which is a well-accepted branch of medicine, there's an enormous amount of information that says, I think I left nutrition out. So there's an enormous amount of information that says if you eat in a certain way, you will create a certain state of health or disease in the body, well documented by research. Physical medicine, chiropractic, physical therapy, like osteopathic medicine, all these are physical branches of medicine, well documented, well researched. If your structure is, if you're misaligned, right, you will create tension in the body. And as you create tension, you create inflammation. As you create inflammation, you create disease. The world of herbal medicine. This is probably the most ancient way people have been, involved in medicine in all of human time is with plants. Plant medicine, and an enormous amount of research there that shows you do this, you get this effect, right?
Since you hit on that,
yeah.
Since you hit on that, before you go to homeopathy,
yeah,
because this is an area, this plant medicine that I really am getting into, and we're going to be carrying a whole line of CBD products on our website very soon. Mm-hmm. Do you get into the area of cannabis in your practice, or is that something that you guys have? It might not be legal in Oklahoma, so I'm not even sure if
it's not.
Could.
It's not in Oklahoma. I follow the research very carefully because, again, it's an ancient herb that humans have interacted with for a long time. And it has medicinal properties. It has practical properties, right? The rope, the oil, paper, the clothing, all the products that can be made right from within that family of plants. And then not even to mention, the cannabinoids and the effect they can have on our body, again, to stimulate healing. So I just want to make this fine point of differentiation is that you can use a substance in the body only one of two ways. It either moves a person towards health or it moves a person away from health towards disease. Anything you put in the body, right? And I'm not saying there's not other factors like the environment and things like that and the way you think, but we're talking about substances into the body. That's it. And you have to always understand what you're doing. So you can use an herb or a nutraceutical or a homeopathic remedy. You can use anything. Not that homeopathy would move the body much down the path towards disease. That's a more technical conversation, but you can use it in an allopathic way, right? I can suppress a cough, but I'm not trying to suppress a cough with an herb or a botanical. What I want to do is actually loosen up congestion and support the respiratory system so that the body is more able to overcome whatever it is they're dealing with at the moment. So I know that was very long, convoluted. There's a lot of research.
Sure.
Lots of research.
So let's get into what I want to learn about today personally.
All right.
Is homeopathy. And just start from the very basics, because I know it's
I will.
A little bit, but I don't know anything really much about it. So tell us what it is. Simply. If you can. I
can. But before I specifically define homeopathy for you, let me tell you that it's based on principles of healing that are they're as old as mankind. And throughout history, there have been periods of time where these were described using different words. And it's just currently being described as homeopathy. And here's what it is. When you put any substance into the body, that substance has an effect on the body, number one. And then in response to that, the body has an opposite reaction. This is very basic. Every doctor, every pharmacist, any kind of practitioner learns this, that a substance causes an effect and the body has a response. Okay.
Fair.
So in homeopathy, we use very dilute substances that will stimulate the body's own healing ability, but it does it using those two principles I just defined for you. We are looking for a substance that can create the symptoms of illness in a healthy person, that when used in a person with those symptoms, it will get rid of them. So let me just make it a really good example here. Let's say you've got someone who has a headache. Okay? It's a pounding headache right here at their temples, and their face is flushed, and it came on very quickly, right? And I won't say it's a migraine. I'm not going to diagnose the headache. This is the presenting symptoms of the headache. Well, in the homeopathic world of substances, there is a particular homeopathic remedy made from the belladonna plant. And if I were to give that belladonna to someone who had no symptoms of illness at all, they're very healthy. If I gave them that belladonna, it could produce in someone susceptible, right? It could produce a pounding headache, flushed face, dilated eyes, right? But when I give it to someone who's got the headache, it will stimulate their body to reduce that headache on its own, following that primary and secondary response, right? I give the remedy, it can cause an aggravation, often not even noticed by the person, but the body notices it, and then the body responds in the opposite direction. Boom, headache is gone.
Interesting. Okay. So how do you use that same principle, homeopathy, with chronic disease? I mean, obviously at some point, you're not just going after a symptom, you're trying to help the body heal it. The actual disease.
Right. So we have acute homeopathic treatment and we have chronic homeopathic treatment. The acute treatment is pretty simple, not complex, pretty much just as simple as I just described to you. A well-trained homeopathic physician, actually a well-trained naturopathic physician, almost any of them can prescribe an acute homeopathic remedy like that, because we learn this. Then you have someone like me who's got extra hours I've put in on my own to become a specialist, or, increase the level of my knowledge about homeopathy more than the typical education that we get. And I can treat chronic illness very effectively by taking a very thorough case, which takes a long time. You have to get as much information as you possibly can so you can understand where the patient's imbalances are. Where are they imbalanced? And you identify those by the symptoms. Like, not everybody who has chronic low back pain experiences it in the same way. It's in a different place. It feels differently. Different things make it feel better. Different things make it feel worse. And they have symptoms that accompany their back pain, like their right shoulder hurts and their mouth gets dry and they perspire and they have to lay down. Like, everybody's different, right? Okay.
Sure.
So those clues create a very individualized picture that helps us select the remedy that covers that symptom picture. We give the remedy, things can get a little worse. We call it an aggravation. And then within a pretty short period of time, the body starts to repair itself. And before you ask, we don't know how it works.
Oh, interesting.
I can describe to you what we see clinically, how a body responds to it. I can tell you of the hundreds of cases of illness I've seen cured and what happened along the way. But what we don't know, any more than we could describe this for most pharmaceuticals, we don't understand the mechanism of action. We don't know what happens when you put that homeopathic remedy in the body. Like, do the cells talk? Does your electrical current change? Do you start, excreting substances in response to the remedy? That nobody knows.
Okay, so we have a question, and I was actually going to ask it before he did. No, that's no problem. But
okay, I see it. Multiple sclerosis.
So Christopher that asked that question has multiple sclerosis, and he's been using, I know, a good amount of CBD to actually help with some of the pain of that chronic disease. So let's talk specifically, if you can, about that disease, or something like my wife's going through with cancer, or just anything that's, as he mentioned, chronic. Back pain isn't a chronic disease necessarily. It could be, I guess, depending on what's causing it.
It can be. Okay.
But something along those lines.
Let's talk multiple sclerosis. We can talk osteoarthritis, rheumatoid arthritis, cancer, any of these severe chronic illnesses. You treat them in the exact same way. You take a very comprehensive case because, Christopher, multiple sclerosis, if you have 100 people in a room, those 100 people will describe their multiple sclerosis in very individualized details. Now, you know, the part of the body being affected can be common between chronic illnesses. There can be some major symptoms that everybody with multiple sclerosis experiences. I won't say everybody. A majority of people experience. But then as you get the details of the case, what you realize is that there are things that are very individualized to that person, right? I'm more cold, I'm more hot, I'm worse this time of the day, I'm worse that time of the day. This particular part of my body is the most affected. If I do this, my symptoms seem to be a little bit better. If I do this, my symptoms are definitely worse. And a lot of there's a lot of information you gather to put together this individualized picture of that person's expression of chronic illness, whatever that chronic illness is.
Okay, that's fair.
So you do the same thing you would do with chronic back pain or someone who's just smashed their finger with a hammer. It doesn't matter what it is. We express our illness in very individual ways, which leads us to choose the remedy that's specific for that. There's 724 remedies of 3,000 plus that can be used for.
Stop.
Yeah,
Let me stop you real quick. When you say remedies, what specifically are you saying? Because that means nothing other than, you know, something's going to help.
That's fair. It is a substance that has been diluted past Avogadro's number. So you cannot find any of the, let's take belladonna, because I used belladonna as a remedy. It's a plant. It provides atropine in mainstream medicine, which can dilate the pupils. Okay. It's very simple. They make a tincture of that plant, belladonna, and then they dilute it. And they dilute it to different strengths, and those different strengths become something known as belladonna 30C. It's been diluted 30 times. Or belladonna 200C. It's been diluted 200 times. By the time you pass a certain point, which I think is 12, you can't find molecules. I mean, you probably could if you hunted long enough, but you can't find molecules of the original tincture. What's left behind is information. And I think a lot of times I get into this conversation, especially when I'm talking to MDs, medical doctors, and they're like, it's a bottle of nothing. And I say I have this little thing I take them through. I call it the CD example. If you were to take a musical CD disc, do we still use CDs these days, or is everything on something else now? Anyway, you take a CD, you chop it up, and you put it in a microscope. What do you see? Plastic, vinyl, paper, some holographic, reflections. Well, where is the music? It's still there in the form of information. And if you had the proper apparatus to take a chopped up CD and read it, you would hear the music. Well, our body is the proper apparatus to read the information that are contained within a homeopathic remedy. So here's a little bottle of homeopathic pellets. And I was looking to see if I had one that is recognizable from the store, but it's in, there's the most common one you find in the store is from a company called Boiron, B-O-I-R-O-N, in little plastic tubes, but it's in a section called the homeopathic section. And it's usually a liquid medicine that has been applied. I don't know if you can see this. I'll try and show you. It's been applied to, how do I get that? I don't know how to do that. There's these little pellets. Can you see those?
Yeah.
Okay, so medication has been applied to the pellets. You take it. Sometimes doctors will put the medication in water, 2 or 3 drops in water, and you take it, and that's it. I mean, that's a remedy. So a substance that's been diluted.
So something as complex as multiple sclerosis, since that's what we started with, that Christopher asked about, is there one remedy, or is it multiple? It would be a multiple thing based on the information that you receive from your patient.
Exactly.
On as far as what you give him. Then
exactly. And I wouldn't just do homeopathy, Mike.
Okay. Fair enough. Go ahead and explain that then.
Well, so the homeopathy is a tool of many to help stimulate the healing, right, of the body. But remember, there's two other very important tenets in naturopathic medicine, which is give the body what it needs and remove what may be poisoning the body.
Okay.
So,
sure. Very important.
So
I found that with my wife with the cancer.
Exactly.
We had to eliminate all the toxins.
Yes.
Every sugar, we had to eliminate virtually everything, and that she was normally eating. She was pretty healthy as before,
right.
but those kind of things really made a huge difference in her life.
Exactly.
Just getting rid of that stuff before even the medicines or anything started.
I was just going to say
really
that.
Helped.
Yeah, so we call that hygiene in homeopathy.
Okay.
And not hygiene as in take a shower, right?
Right.
Hygiene as in, are you eating what you need to eat? Are you hydrating the way you need to hydrate? Are you supplementing with vitamins and minerals? Because, you know, I'm sure some of your guests have told you this. Our food may have the vitamins it needs, but our food definitely does not have the minerals that it needs. The minerals are depleted from our soils unless you consciously and with purpose mineralize your soil and grow your own food. No matter how healthy you're eating, I can tell you you're eating mineral deficient food.
Sure.
So,
sure. And by the way, Dr. Dorban, my partner Wayne, that is the space that he comes from, the green space and sustainable farming, and he's into aquaponics and all kinds of stuff that way. So that's important. And I agree with everything you're saying. I know he would, and I think most of our guests would totally agree with that. One thing I wanted to get to real quick, because I wanted to ask it earlier. My head's spinning right now.
Sorry.
So we're talking. Oh, that's okay. I want it to be. That's how I learn. Now we're talking about homeopathy. What kind of research and scientific evidence is it something that is done like drugs? Is there double-blind studies? Is there peer-reviewed studies that goes into homeopathy, or is it more anecdotal as far as the results? Can you talk to that a little bit?
I can. And the answer is yes to all of that. So,
okay, great.
And this I think is true in any field of medicine or any profession, is that let's start with the non-scientific observations, right? So you have somebody or many people who do X, and the majority of them report Y. They see it. It's not an official investigation. It's just over time, over a lot of time and a lot of different trials of this, right? Trial and error or applications of X. This is what people see. And I can just say, you know, a great example of that for people is if you drive your car into a wall, the car is going to get squished. There's no scientific research needed for that. You do this happens. So there's an element of that, not only in homeopathy, but in all of medicine. But in homeopathy, we also have this peer-reviewed research that's done. As you can imagine, it is incredibly difficult to get it published in the allopathic world, although there are articles that are published, and I feel I should have gotten a list of current research, and I apologize, and I could get that to people or get it to you and you could get it out to people. We could deal with that, but there is, right? But there is this problem when you start talking about the scientific method and using your standard statistics to analyze. Mainstream medicine wants to take substance, number one, and placebo. They want to give substance, number one, to 5,000 people and then say, this was the effect of substance number one, right? And they do the same with placebo. Okay.
Sure.
Sometimes they're giving it to people with symptoms and they are recording the symptoms that go away. Sometimes they're giving it to people and seeing what happens. In homeopathy, because each person's case has to be very individualized to choose the most appropriate remedy, as you might be able to imagine, it's very difficult to take your standard scientific method statistical analysis and apply it, because if I have 100 people in a room with epilepsy and I'm going to prescribe, I'm not going to prescribe the same remedy for all of those people. So now you've reduced your sample size from 150 or 100, whatever I said, to potentially 1 or 2 or 3, which makes statistical analysis very insignificant because you have a very small sample size. And so we've had to be creative over time in how can we set up good quality clinical research, scientific research that can show that there is a difference when you use homeopathic treatment. Not when you use a specific remedy, but when you use homeopathic treatment in general. That's the body of literature that is growing very nicely. Last,
yes.
Oh, sorry. Last,
no, go ahead.
Is the sort of physical investigations they're doing into the properties of remedies. Can we show with scientific equipment that there's a difference between this homeopathic remedy and this homeopathic remedy, even though there's no molecules of the original substance here? Can we show a difference between these? And what's really exciting is there's several current studies that have been able to show a difference between the remedies. So that's
nice.
That's
nice.
That's
you know,
and
and I appreciate that, and I think it's an honest answer and it's a fair answer. You know, personally, with what I've been going through with my wife, and by the way, those that don't know, she has bladder cancer, and she chose to go about it initially, at least, all naturally. That is, no chemotherapy, no radiation, and no surgery. Not even a biopsy, if you will. She just wanted to try the different natural alternative methods out there to cancer, because we've had friends of ours in the last year that have just died horrific deaths. And I'm not saying they died those deaths because of the chemo, but the quality of life because of the chemotherapy was just unbearable. And my dear friend, who I rode motorcycles with and went to Sturgis with and those kind of things, he died last year, and his last 8 months, he was dead 8 months after he was diagnosed. He only spent 30 days at home those last 8 months. The rest of the time was in the hospital. Something like 4 surgeries, just tons of rounds of chemo and radiation. And he told me 2 weeks before he died, if he would have known what he knew then, 2 weeks before he died, he would have had none of it. He would have rather just lived the last 8 months at home and died naturally. That hit home with me. That was a tough deal to deal with. So that was kind of my wife's decision to go there. But getting back to my original point, I'm sorry to get off on that tangent, but is that, to me, anecdotal evidence is much more important, and the results of what's happening in my wife are much more important than what some scientific study says will or will not work. Because there's tons of studies on chemotherapy, tons and tons and tons. Every drug that comes out, every chemo drug that's come out in the last 70 years has gone through those type of studies. And the results don't get any better as far as overall.
Mike,
yeah.
We have a really good question over here from
great.
I see it.
Yeah, if you see that there.
Yeah,
okay.
Can I answer that?
Yeah.
Okay, so I may have said those exact words, but let me clarify maybe more what I meant than the actual words I used. A lot of homeopathic remedies are made from very toxic substances, like belladonna can be very toxic, or digitalis, or there's a number, right, of substances which in their form could be very dangerous to someone. And so when I say they don't have any active substance, they don't have the molecules of the toxic substance because you have diluted it. The molecules may be there in some form, but what is there is active information. Right? So if I take a dose of belladonna 30C, I'm not taking any substantial amount of belladonna, the plant belladonna. Therefore, there's no risk of me causing toxicity to my body or to one of my patients. But there is activity there. And like I said, I think, but there's no molecules. So, and I'm not sure who's asking the question. There is information. There's information left as you dilute a substance, and the action we see becomes stronger on the human body the more it's diluted. It's the other side of the number line, which, right, we know you can go too much, so you can go the other way as well.
Hey, with that, I don't know if I think you've covered most of the subjects I want. We've got quite a few people in the room. Would you be object to letting somebody jump in and ask some questions of you?
I would not mind at all. I just want to make sure for CJ Robamund, I wanted to make sure that they understood the differentiation I'm making, right? If you try and find it biochemically, the belladonna, you might find a molecule or two, but that's not the main point. Not clear. Well,
let me take another shot at it.
Okay, so thanks.
I have a little bit of training there. I think what you mean is that when you dilute to whatever level ends up being appropriate, the body is going to react very differently than it reacts to a toxic element at a much higher concentration. Our body reacts to different kinds of toxins in 3 different ways. One way is that over a gradual exposure to a toxin, your body doesn't regulate it, and over time, you don't really see any symptomatic types of responses. But at some point, you reach a point where it's now accumulated to a certain amount in your body. All of a sudden, your body goes into a reactive mode. That's one way. The second way is when you get exposed to a high amount, a high dose at any given time, an acute type of an exposure, your body immediately reacts. Now, the level I might react to from an acute perspective could be completely different than the amount that you would react to or that you would react to. And I mean orders of magnitude different.
Yes.
And what might be acutely toxic, deadly to me, might be a cure for someone else. And that's what I understood, by the way, that most of the homeopathic types of uses in the way that they react. So that's why you need to start with very dilute amounts where you probably aren't going to have that toxic reaction. You're going to have that accumulative reaction, which ultimately you wouldn't react to if you didn't continue to take it. But if you took that really high amount, you might react acutely and it might have a real negative impact. So that's at least a little bit of my understanding of it and the way that I've seen people and animals and plants and others react.
Right.
And I think he did say, okay, I'm with you so far. So hopefully that cleared up, CJ. And if you want to jump in after Eric, feel free. Eric, how you doing, bud?
I'm going to block him forever. I'm going to block him forever. He's going to talk. I'm going to filibuster. I might have misunderstood you, Mike, when you said that chemotherapy, the testing results don't improve.
No. What I meant was if you look at chemotherapy and the results of it as far as longevity of life, they haven't changed much in 50 years. As far as tons of new drugs, they're all tested, obviously, before they go through for efficacy and everything else. My point is, on those drugs, the life expectancy on any myriad of those drugs haven't changed much. Certain cancers, they have improved, and that helps the overall. But the big picture is they haven't improved greatly. Not what I would suspect with all the billions of dollars that have been put into it, to the research
I don't
show those results.
They do bad though.
And I'm not saying they do bad.
I'm really glad your wife is doing well with whatever her therapy is. That's what's important.
That. Exactly. You're absolutely right. It's what she's chosen is something most people shouldn't choose or probably wouldn't want to choose, but it's working for her, and that's what's exciting. And I'm not belittling or saying anything negative as far as the cancer thing. The only negative thing I would say is the life expectancy of people going through that has not changed dramatically in the last 50 years. And you can look at it statistically.
But you know what has changed?
Huh?
What has changed though?
No, sure.
Is the tolerability of the therapies now.
Well, you know what's interesting about that, Eric, is that our product, which is a bioidentical product, BioPro Plus, has helped myriads of people get through cancer treatments, chemo, radiation, because it is the same protein molecule that your body produces from their thymus gland. Well, at about the age 40, you no longer produce this protein. It's
a good thing I'm not 40. What about at 51?
Yeah, you're not producing it anymore. After the age of 40, your thymus gland is basically used. Its life purpose is about over, and it doesn't produce this protein. This protein synthesizes CD8 cells, which helps, or CD4 cells, which help the immune system build up. So people that are going through chemo, and it sounds like you did, Eric, and I didn't know that. So that's
25 years ago.
So you can tell me exactly. I had several friends that were going through chemo, and their immune system got so pushed down, so basically their immune system was not there anymore, that they had to stop their chemotherapy. Well, they started our product, and it got their immune system and their white blood cells back up to a level that they could continue with the chemo. And we've had patients, or not patients, clients, customers that have gone through chemotherapy and not even lost their hair because their immune system was strong enough to resist the effects of the chemo. It allowed the chemo to work better.
It makes perfect sense.
And that's what's exciting about it, is that, and those are the things that I think you're talking about, that I'm passionate about helping people with that. I would never tell anybody not to go through chemo or not to go through radiation. Yeah.
I get that. Just as an FYI, I found the radiation much more difficult to tolerate than the chemo. And the chemo that I had was ABVD. It was adriamycin, bleomycin, vincristine, and doxorubicin. I had 6 cycles, which was 12 treatments over 6 months. And I did lose my hair, but I tolerated it okay, actually. The radiation was mantle, so it was from just under my nose down to about halfway down my chest. And that was like getting hit by a bus. Wow. I couldn't taste food after that for about 6 months. I weighed 108 pounds at the end of everything. Wow. Yeah. So
thank God you're here, man.
It's not easy. But for me, I had Hodgkin's disease, and it works for like 95% of the people, and almost 100% that have no other health complications.
So Eric, because I don't want you filibustering CJ too long. What question did you have for Dr. Camp?
Well, it wasn't so much for Dr. Camp. I just sort of wanted to make sure I understood what you were saying about chemotherapy. Okay, cool. And I think it's an important conversation to have in conjunction with the products you're talking about.
Totally agree.
Like you're bringing up the point of the ability to tolerate better, and for the efficacy of the chemotherapy to be greater. So with that, I'll drop off. And thanks for everybody. It's been a great blab.
Great. Thanks, Eric. Appreciate it.
Oh, it's good, man.
Cool. So anybody else want to jump in? Please jump in.
We've got several other comments here from Blue Streak Psy. Maybe Dr. Eli would respond to some of his thoughts, just because he's given some good thoughts there and had some experience with some chemo with his family. So
I see 2 comments. Are you referring to that?
Yeah.
Okay. So I think that every day there are people with certain kinds of cancer at certain states of progression that have used chemo, they've used radiation, and they've used chemo and radiation together, and that they are still alive because of it. And I'm thankful for that, for people who choose to go that route as well. I mean, I'm thankful for that for people. I also know that there are people who do other things when they've been recommended to receive chemo and radiation, and they decide not to, and instead they decide to do a variety of things like juicing and meditating and praying and nutraceuticals and botanicals and physical medicine and homeopathic treatment and a number of these other alternative, imagine we're on alternative health concept show here, but other alternative things that in the right combination under the right guidance have achieved the same quote unquote cure or resolution of the cancer. So I've seen both. And I've seen people use both. Right? Holistic approaches and the typical conventional mainstream. So I'm not sure what else to say to.
I think actually in response to him, I agree with what he's saying. And I too am so happy that his wife made it through.
Yes.
I look at cancer, and I think if you look at any scientist or talk to any scientist, which I know he is, and we talk to different people, whether they be in the alternative world or the medical world, the mainstream medical world, cancer or any chronic disease is what it's all about. It's a huge jigsaw puzzle, and what we know today, we'll know more tomorrow. But what we know today is that it's a huge jigsaw, and that it's many pieces of the puzzle. Chemotherapy, radiation, surgery, in and of itself, usually doesn't take care of the underlying cause of the cancer. In some cases it does, and that's great. But in most cases it doesn't. There's a reason, there's an underlying cause why the body got cancer, and why it wasn't able to get rid of the cancer itself. So you have to understand that underlying cause. That's why to me it's a huge jigsaw puzzle. And you may, depending on the type of cancer, need and have to have chemotherapy, radiation, and surgery. But to get to the underlying cause, to help build the immune system, there might be some other problem or some other products that you might need to use, or some other energy type healings that you might need to use. I guess that's what I'm trying to say with what we're saying. We would never, and I would never, our company would never advocate somebody not doing modern medicine, because modern medicine is valid, it's true, it's proven, it's shown to have good results. But I will say that there are a lot of products, a lot of modalities that are not those three that work, that are scientifically proven, and that in some cases are prohibited here in the United States to be used. And that's sad to me. That's real sad to me, but that's a whole nother blab. We're talking about homeopathy and what it can do for you, and what your specialty is, and that's what we're talking about.
Change subjects just briefly, because
feel free.
With Dr. Eli's websites and what she's doing, I know I have several really good friends that are naturopaths, that are homeopaths, and practicing alternative medicine, who are struggling financially, who actually do get disdained by the traditional medical community. So there isn't nearly as much love going around there as we're having right here on this site, where people are agreeing and disagreeing with different thoughts. Instead, it can get pretty hostile. You seem to be making some money, so I'm going to focus on a little different side of this, doing a bunch of really cool things on your sites. And on Medicine Talk, for example, you have a number of your recorded talks that you've had in the past that you give away, and others that you sell. Talk a little bit about the monetization of that side of your business. And I love the consigliere practice that you also talk about. But talk about the how it's worked for you as you've used a monetization approach to get your information out.
Mm-hmm. So, one, I do think that as in any profession, there are people who struggle and they are not as successful business people as some. I don't think it's particular to naturopathic medicine. There's fewer of us, and therefore the statistics are kind of skewed. If we had 150,000 NDs, I think you'd see similar statistics to any profession. Doctors don't earn business degrees, and therefore they come out of school. They have a hard time wrapping their head around how to run a practice, and they don't, well, you know this if you have friends who are naturopaths, they don't have the same opportunities for employment often that their other medical colleagues have. So for me, Medicine Talk was actually much less about monetization and much more about education. I was seeing, I was, and I am, I have a 2-year waiting list. So I'm not one of those NDs who struggles with the financial flow. I had a business background. I have a marketing background. I get people better. Not that other NDs don't, but I'm very visible, right? I talk a lot. I'm on the internet. I'm out there. I write stuff. So I'm very visible, and that helps bring patients to me. But my vision for Medicine Talk in and of itself was that every person could have a naturopathic doctor on their healthcare team. I am a collaboration thinker. I think community is the way to go in every way, shape, and form, and that includes with your healthcare. I think we should all have a naturopathic doctor. I think we should all be working with a variety of different kinds of healthcare trained people, because that team of people can address different things, right? It's just like, I wouldn't hire one person to build my house. I need a plumber. I need an electrician. I need a variety of people to get my house built. Well, I need a variety of people to set my body in order. But most importantly is I need to know what to do. And so I work with a small group of people, but I want the world to know this. So I'm like that sneezer out there, right? Sneezing molecules of naturopathy. So we do charge for very few things on Medicine Talk. Most everything is free. It's up to the speaker actually when they come to speak for us, whether they want to charge or not. The live events are always free.
Nice. Hey,
yeah.
hey.
And that was a wonderful answer. And by the way, C.K. Almquist, I hope you heard from the answer exactly what I was hoping, because I didn't even prompt her, but she did, is that's the relevancy here, is that I think that what she ended with there, which was we all need a whole variety of different specialists, experts in our lives to help us, is what is really the message here. And I don't think it's wrong that we use a whole different array of ways to get that information and that our thought process out there. So that was the questions there.
We're right at the top of the hour, and I kind of wanted to end it today, our Blab doctor, with give us an example, because we're getting into homeopathy and how it works. Can you give us an example, obviously without any names, of somebody that had a chronic disease and what you did, what you took them through, if you've got a few minutes to maybe what the end result was from the start? I would love to hear an example of what you do and what you do with your patients.
I do. I'd actually like to give you 3, and I can do it quickly. I want to give you my very, very first case ever as a student, and I was an MD, PhD track doctor. And I decided that I wanted to become a naturopathic doctor. And I tell you that because that's the way my brain was being trained in the scientific world. And my scores were high enough, and I was there, right? So I could have done that. But I go to naturopathic school, and in the first 2 years of naturopathic school, you get all the ologies. You get anatomy, physiology, oncology. You get all that. And then you go into clinical rotations and training while you're still learning didactic stuff. And I'd had a couple of classes in homeopathy, the basics, what are remedies, what's the history of homeopathy, who's using it today, blah, blah, blah. And I was interested, I was curious, but here's what did it for me. I'm on shift, and I'm a first year clinical, so I really didn't get to do anything with patients at the point that I had started clinic. I got to watch, right? I got to watch and learn, And this mom comes in, she's from France, and she's carrying in her arms, completely draped over her arms, limp and moaning and pale, her young son of 5-ish, maybe 6. She comes in and I get assigned as what's called the secondary. So I'm the tag along, the errand girl, whatever I'm watching. And they do an exam. And of course, I get to look in the child's ear, which is a dark, dark purple. He has an ear infection. And he's had an ear infection for several days. He's not eating. He's running a slight fever, you know, an elevated temperature, nothing major. But he's just almost comatose. I mean, I'm really worried. I'm like, this is a sick baby here. So look in his ear, whatever. We go over to the room where the students and the doctors talk and figure out strategy. And we're going to do a homeopathic remedy. And it turns out to be lachesis, or some people pronounce it lachesis. It's a remedy that you would give for some dark purple, very painful, left-sided ear pain, right? Among other things, but that's another thing. So I get sent down to the medicinary, go get the remedy, bring it in, go ahead and dose the child right there, blah, blah, blah. I do that. And then my mentor, Dr. Stephen Messer, says, why don't you just stay in there? Stay in there and just sort of chit-chat with the patient, with the mom. So I do, and it's about 15 minutes, Mike, that I notice all of a sudden the child is actually sitting up with some color in his face, rooting around in mom's pockets for some crackers to eat. And he's starting to sort of chatter, and then he wants to get down and run around. So I'm like, huh, well, that's pretty spectacular. Well, to make a long story short, I go running back to the room where all the doctors and the students are. And I'm like, I bust into the room, and I think Dr. Messer knew. He stopped the discussion of the next patient. And he said, yes, Eli? And I was like, he's better. He's better. He's better. So we all go down. We look in his ear. His ear is perfectly 100% normal. That's what hooked me. And from there, my next case was a little boy who had seizures. He was having about 60 seizures an hour, 60 to 70. They were short. And his mom called me because she had left the neurologist who wanted to do the procedure where they split the brain in half. They cut the corpus callosum. They disconnect the 2 halves of the brain in the hopes that they'll stop the electrical current flowing between the 2 halves. And in some way, this will stop the seizures. It is sometimes successful, sometimes not. So she called me and she said, before I cut my son's brain in half, do you think a homeopathic remedy could help? And I said, I don't know. I don't know, but I'm willing to take the case and prescribe a remedy. And within 6 months, we had him seizure-free.
Wonderful.
Seizure-free, and to this day, 8 years later, he is seizure-free. And that was a case of just a homeopathic remedy. And then I'm currently working with a woman who came to me in a wheelchair. And I don't know if our guest is still on the line who has multiple sclerosis, but that's what she came to me for, was multiple sclerosis.
Yeah, Christopher's still in the room.
Christopher,
actually, I see him still in the room. So
okay, so she came to me in a wheelchair. I would say she had lost pretty much 80% of function in multiple systems. Very scared, just scared. And I would say, very eclectic naturopathic medicine with her. We addressed food, and we addressed a number of things, but I prescribed a remedy to her. And over the last 6 months, she has slowly and steadily regained function. She's no longer in a wheelchair. She now uses a cane to help get around, but she continues to improve. So I have many of those, but those are those 3 that pop right to the front of my head. Yeah.
Oh, it's exciting. I mean, again, anecdotal, but if it's working, the person in the wheelchair that's not in that wheelchair anymore, who cares if it's, and I know it is, there's science behind it, but who cares if there isn't? We see a lot of that. I'm getting a lot of that right now. And there's a lot of good research, but it's still not accepted mainstream medicine, and that's from the cannabis industry. There's some amazing things going on with that, and I don't know. I know there's tinctures. I know there's some great products out there that we're going to carry on our website from a particular company that makes a nano encapsulated form of the CBD. But I don't know if there's homeopathy with CBD yet, or if anybody's taking it to that level.
You mean, is there a homeopathic preparation of cannabis?
Yes.
There is.
Yes. Oh,
there
okay.
is. Yeah, it's like most substances we know. As long as it has an effect on the human being in some way, you can prepare a homeopathic remedy. Now, and the symptoms of someone who might need homeopathic cannabis are, they're varied, and there's a pretty rich materia medica, and that's just the list of information we know about what it can cause, therefore what it can treat. You know, I didn't say something really important, that this is governed by the law of similars, like cures like, right? This is how you choose a remedy. And I try not to get too technical, because people who have not been exposed to homeopathy can really quickly get, you know, lost in the explanation. But yeah, there is homeopathic cannabis, and I don't use it a lot in my practice, actually, but when it's needed, it is nothing short of miraculous.
Yeah, and that's what we're seeing in a lot of different references. I won't go into it all, but Christopher asked, can you discuss specific treatments that got her out of the wheelchair?
So,
since that's relative to him.
Yeah.
I know he's not, I don't think he's in a wheelchair.
I can, but I want to preface it by saying this is what worked for her. I've treated a number of patients diagnosed with MS, and while we addressed each area, we did different things. Okay, I just want to say that. It's not protocol medicine in any way. So we started by having her juice. We had her juicing carrots, and we had her juicing spinach and kale, and fresh apples and fresh pineapple for the digestive enzymes that those fruits contain. And she started growing eventually some of her own vegetables, because we know for sure that food that's just picked is more potent because it hasn't started to oxidize, and right, the enzymes are still living. So she juiced twice a day. And she took out all of the common foods that have been shown to trigger an inflammatory response within the body. Eventually,
so most likely grains or gluten and those type of things. Sugar.
Yes, she took out gluten and dairy and egg and coffee. She took out sugar, and she took out soy. Now, I suspect she had sort of leaky gut syndrome when we started together, and her tests were indicating that she was reacting to everything. So I didn't have her take out everything. I had her take out the most common ones. I took her off of all processed food. She ate nothing but real food, so nothing processed. And I put her on high doses of essential fatty acids. I made sure she was taking Polarmins, which is a very wonderful mineral formula. And Mike, I'm not super familiar with your products, so if you have something that I mentioned that you have, I'm not excluding you. It's just what I use.
Yeah, sure. No. Okay. And this is about you. Okay. This isn't about us. We're sponsoring it, and I'll get that at the end.
I used a whole food based multiple vitamin that we ended up changing to a something she could put in a smoothie. I had her on additional digestive enzymes between meals, because when you take digestive enzymes with your food, it works on the food. And what I wanted to do is have the digestive enzymes work on some of the tissues and inflammation in her body. And then on her own, so those are the basics that we did. I made sure, that what else she was doing. People are always doing things on their own, because they're always doing internet research, and they're always reading, and I think that's great, and I encourage my patients to do that. And so she was doing some things that I thought were great that I didn't touch, like turmeric, and I'm not sure who Wall is or what Wall's protocol is, but if it's good old give the body what it needs and get the toxins out and stimulate the healing ability, then it's Wall's. It must be. We also then, I had her take out processed foods. I had her, I did a home visit with her to evaluate what her environment was like. We changed out her water got rid of the chlorine. So made some changes like that. We got her some good body work being done on her body to help release the toxins. And we needed to do some stuff to get her using the bathroom. Because, right, I mean, the toxins sit there and reabsorb. So we started her off with a colon hydrotherapy session to get her going because she was having some constipation issues. And then I taught her husband how to do abdominal massage and a couple of good yoga poses and stretching and staying hydrated, and the homeopathic remedy. And that's what I did with her. And
so is she still a patient of yours? Is that still ongoing? Or
yeah,
is this,
we're still working
obviously
together.
This doesn't happen overnight. There is no magic bullet.
No, yeah, we're still
body.
working together. And she's doing so well. She feels so well. She called me. She actually thinks that she was not wheelchair bound for a few days before she realized that she wasn't wheelchair bound. But she called me the day that she spent the majority of the day out of the wheelchair and in tears, which of course we're girls. I cried. Yeah. She cried. Everybody around me cried because it's a moment of celebration.
Oh, you're not kidding. I would have been crying. I mean, it's just, those are amazing type of stories. And
well, can I add something to it? Because my critics would say MS is known to spontaneously go into remission. There have been documented cases of MS going into remission. In fact, it's a remitting condition. It can come and it can go. In this case, we are watching slow and steady progress that didn't start until we started our protocols. And I always have that conversation with the healthcare professionals that call me and say, well, you can't say it's this. And I look at them and I say, well, okay, but I'm gonna, because I can, because it's my patient, it's my treatment. And yes, I can.
Yeah.
So
absolutely.
That's a little attitude for you.
Wonderful. No, I like that. I mean, call it attitude, call it, just understanding what you do, being a professional. I would call it a lot of different things, but I appreciate that. And
CJ, it's not a leap of faith. These are like the laws of the universe, right? If you put poison into a system, you poison it. If you poison the soil that plants grow in, the plants don't grow. We're working with what I consider to be the logical laws of nature and healing here. Not a leap of faith. It's logical to me. You feed the body what it needs, you get the toxins out of the body, and you stimulate the healing ability, and you restore health. You can't help it. It happens whether you want it to happen or not.
Yeah, I would say to that comment, and I kind of understand where CJ why he would say that, but I think the underlying question to that, is it a leap of faith to say that the body has its ability to heal itself? If that is a leap of faith, then what you just described is a leap of faith.
Yeah,
but
sure.
I believe, and I think science proves out in the thousands and thousands and thousands of years that humans have been on this earth, not counting the last 150 years before quote unquote modern medicine's here, we pretty much showed that our bodies have the ability to heal themselves. And
would we be here?
Exactly.
Mike, would we be here? How old is pharmacy? How old are vaccinations? How old is the human species? We're still here, of course, with the ability to heal ourselves.
Right. And so that I don't see it as a leap of faith. I think it's understanding how the body works, giving the body the right product, the right substances or nutrition that it needs. As you said, get rid of the toxins that we're putting in. That's the one thing that's happened in the last 150 years that we didn't have the thousands and thousands of years before, these huge loads of toxins that we put in with what we breathe, the chemicals that are in our water, the medicines itself, the synthetic chemicals that we are putting in our body. The average person in America takes 4 prescriptions a day, 4 different prescriptions. I mean, you can go on and on and on with the amount of crap we put in our body. You got to get all that out.
You do. And CJ clarified his question. I'm sorry, CJ, I jumped to conclusions. And I didn't say homeopathy was the cure. I said what I'm doing is the cure. The combination of following the laws of healing, giving the body what it needs, taking the toxins out, and stimulating the healing ability. That's what I'm going to say, yeah, is the cure.
Yeah.
All of it together.
Sure. Great. Well, listen, I think that was a great note to end on. I'd just like everybody to thank you for being here, number one. And if you're watching this on replay, please go to our website and find out more about what we offer. We are a educational-based company that we're trying to educate people with alternative means, not to do away with allopathic medicine or any therapies that people might be going, but only to enhance those with a particular product that is unique to us that we manufacture, that is a bioidentical immune supplement product that works amazingly because it is extracted from the thymus gland, and it's exactly the same proteins that your body produces to help fortify your immune system. It is the protein, by the way, that modulates your whole immune system. Without these proteins, you have no immune system. So that's what's exciting about it, and we're really excited to have it. We just opened a new line. My dad's a equine veterinarian, so we started there. We're coming out with animal products, but we started with horses because that's his forte. So we have BioEqualizer, which is the same basic product, little different formulation for horses, much larger than humans. And then we're going to be coming out with the same product for dogs and cats here shortly. So that's kind of it in a nutshell. Go to our website, get the free book on how to build your immune system. It's not intricate stuff, guys. It's basics. It's basic stuff that what our bodies need. Put in the body the right thing, get out of the body the wrong thing, and your body can heal itself. We believe that, and that's what we go by. So thank you once again. Really awesome. I mean, I've just had a great time. Real quickly, I will say, we always have a test blab with our guests, particularly if they haven't been on Blab before. Try and show them how it is. It was supposed to be 10 minutes. I think we talked for an hour last week, and I learned so much from you. I just really, really appreciate you, and hopefully we can do some collaboration in the future.
I would love to. I would love to. What I'd love to do is even maybe let you know periodically when we have events coming up, because it's not interactive like this, and I love this format, by the way.
Sure.
But it is a really good place for people to learn from naturopathic physicians. And I'll just let you know about the events. Like I said, the live ones are free.
Please.
So
absolutely. Love that, and love to come on and participate in those any way we could and help out. Thank you again for being here. Appreciate all your help for being here. And let your body heal itself. It will. Thanks a lot, guys.